Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
GERD. Pediatrics. Introduction. GERD is when stomach acid repeatedly flows back into the esophagus, the tube that connects the mouth to the stomach. GERD is an acronym for gastroesophageal reflux-disease. GERD affects about 5 to 8% of children worldwide. It is especially common in children who were born prematurely. If left untreated in children, GERD can lead to serious complications. These include failure to thrive, apnea, and asthma. Fortunately, treatment is available to help relieve the symptoms of GERD. This program will help you better understand the symptoms and treatment options for GERD in children. The esophagus and stomach. GERD is a condition that happens when stomach juices repeatedly back up into the esophagus from the stomach. This section will help review the anatomy and function of some parts of the digestive system. Swallowed food goes through a long tube called the esophagus to the stomach. Acids in the stomach start breaking down the food. Acids, or gastric juices, usually stay in the stomach. They are blocked from going up into the esophagus by a valve. The lining of the stomach is made up of cells that can tolerate acids, but the esophagus lining is not able to tolerate these digestive acids. The valve is made of two muscles that help prevent the backflow of the stomach content and gastric juices into the esophagus. This backflow is known as reflux. The first muscle is found where the esophagus and the stomach meet. This area is called the gastroesophageal junction, also known as the lower esophageal sphincter, or LES. This muscle lets food go into the stomach, but not back into the esophagus. The second muscle is the diaphragm. This is a large muscle that separates the lungs from the abdomen. This muscle is needed for breathing. The hole in the diaphragm through which the esophagus goes into the abdomen is known as the hiatus. The hiatus also helps prevent the backflow of juices from the stomach into the esophagus. If these muscles do not function properly, gastric juices can go back into the esophagus. This can cause heartburn, known as gastroesophageal reflux, or GER. GERD. The valve mechanism that stops digested food in the stomach from flowing back up the esophagus may not function properly. If this happens, acid juices are able to go up into the esophagus. They can sometimes reach the mouth. This is known as GER, or gastroesophageal reflux. Repeated GER can cause the acid to irritate, destroy, and scar the lining of the esophagus. From the mouth area, the acid juices can flow into the lungs. The effects of the acid juices on the esophagus, mouth, and lungs are what cause the symptoms of GERD. GERD is the disease associated with serious GER. Gastroesophageal reflux is common in people of all ages. Children often grow out of GER before they are 1 year old.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Complications. If not treated, complications of GERD may include inflammation of the esophagus, stomach ulcers, the increased risk of esophageal cancer in adults. Scarring that may narrow the esophagus can also happen. This is known as esophageal strictures. Esophageal strictures make it hard to swallow. Strictures are not common in babies and young children, but they may happen if GERD is left untreated. In babies and young children, GERD can cause failure to thrive. Failure to thrive is when a child is not gaining enough weight or growing like she or he should. A child with GERD may refuse food because of the pain caused by the condition, or he or she may try to eat but may not gain weight because of vomiting. Pediatric GERD can also cause children to have apnea. Apnea is when a person stops breathing briefly. This happens when the acid makes it all the way up the esophagus. The acid may bring partially digested food with it and temporarily block the airway. There is also a link between children that have GERD and asthma. 75% of all people with asthma also have GERD. Causes. The main cause of GERD is weakness of the sphincter muscle in the lower esophagus. It is called the lower esophageal sphincter, or LES. Some substances can cause this weakness. These include caffeine, nicotine, alcohol, chocolate. In children, weakness of the lower esophageal sphincter is common. Once children learn to sit up and their muscles grow stronger, GER often goes away. For many children with GERD, the muscle of the sphincter in the lower esophagus does not get strong fast enough. GERD can be caused by or made worse by certain foods, such as citrus fruits, fatty and fried foods, garlic and onions. Other foods that can cause or make GERD worse include mint flavorings, spicy foods, tomato-based foods like spaghetti sauce, chili, and pizza, vinegar. Other medical conditions, such as hiatal hernias, increase the likelihood of GERD. A hernia happens when organs inside the body can push through weak muscles. In a hiatal hernia, a weak muscle in the diaphragm causes the upper part of the stomach to move above the diaphragm. Some children are born with a hiatal hernia. In these cases, the diaphragm is unable to help prevent reflux. Symptoms. GERD can cause significant heartburn. While adults can express their pain to a healthcare provider, babies and children may not have the language skills to be able to describe it. Children with GERD may just say their stomach or chest hurts, especially after eating. Symptoms of GERD in children may include bitter or acidic taste in the mouth, sore throat or painful swallowing. Symptoms of GERD in children may also include hoarse voice, recurring pneumonia or ear infections, frequent vomiting or spitting up. Symptoms of GERD in children may also include wheezing, weight loss, refusing food or eating frequently. Babies who have GERD may arch their back or neck after eating. They may also have symptoms of colic and not gain weight. Symptoms are usually worse when the child lies down. Lying down lets more juices flow back from the stomach to the esophagus. This causes more heartburn. Some children may also have coughing spells when they lie down. This is caused by acid juices flowing back up the esophagus and then down into the lungs through the breathing tube. Coughing helps expel these harmful juices from the lungs. As they flow into the lungs, these acidic juices could injure the vocal cords. This may lead to hoarseness. If left untreated, the acids can destroy the lining of the esophagus. This could cause significant medical problems. Diagnosis. Other medical conditions can cause symptoms similar to those caused by pediatric GERD. Your pediatrician will help determine the exact cause of your child's symptoms. Usually, pediatric GERD is diagnosed through your description of your child's symptoms and a physical examination of your child, but some tests may also be ordered to confirm the diagnosis. An upper gastrointestinal, or GI series X-ray may be done. This is used to check for any damage to the esophagus, stomach, or intestines. Before a GI series X-ray, your child must drink barium. Barium is a chalky drink that makes the organs easier to see on the X-ray. X-rays can rule out other problems with similar symptoms. An endoscopy may be used to diagnose GERD. Your child will be given a sedative for this procedure so that he or she is sleepy. A small, thin tube with a camera is inserted into your child's mouth through the esophagus and into the stomach. A biopsy may be done during an endoscopy. A biopsy is a sample of tissue taken during an endoscopy. The sample is then examined under a microscope. A biopsy can tell if there is damage done from acid or if there is another problem. Another test that may be done to diagnose GERD is an esophageal pH probe. It measures the acidity in your esophagus. During a pH probe, a thin wire with an acid sensor at the tip is inserted through the nose. It travels to the lower part of the esophagus. The probe determines how much acid is coming back into the esophagus. Treatment options. The first treatment option for GERD usually includes some lifestyle changes. For babies with GERD, you should burp your child often during feeding. Also, keep your baby upright for 30 minutes after every feeding. This can prevent acid from backing up into the esophagus. Older children should eat smaller, more frequent meals to lessen the symptoms of GERD. Children with GERD should also avoid these foods: chocolate, caffeinated drinks, carbonated drinks, fatty or spicy food, mint, citrus fruits, tomatoes and their byproducts. Children with GERD should also be kept away from cigarette smoke. This includes secondhand smoke that is exhaled by a smoker and thirdhand smoke, which is the toxic residue left behind by cigarette smoke. Thirdhand smoke clings to walls, carpets, clothes, cars, other surfaces. Sleeping with 1 or 2 pillows may also help. Symptoms can get worse if your child is lying flat on his or her back. As an alternative, you can prop up the head of the bed where your child sleeps with wooden blocks. Avoiding lying down after a meal will give the stomach enough time to empty. This can decrease some symptoms of GERD. Avoiding tight clothing can also help lessen GERD symptoms. Make sure your child is not wearing clothing that is constrictive. Medication may be recommended if your child still has GERD symptoms after trying these lifestyle changes. Over-the-counter and prescription antacid medications may help decrease the acidity of the stomach. Medications are also given to strengthen the muscle of the sphincter in the lower esophagus. Some of these medications can have significant side effects. It is important to tell your healthcare provider or pharmacist about any medical conditions your child has had and medication they are taking. If other treatments are unsuccessful, surgery may be recommended. Surgery for pediatric GERD is rare. Most children with pediatric GERD improve with some lifestyle changes and medication. But surgery may help if lifestyle changes and medications are not helping.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. GERD is when stomach acid repeatedly flows back into the esophagus, the tube that connects the mouth to the stomach. GERD is an acronym for gastroesophageal reflux disease. GERD affects about 5 to 8% of children worldwide. The valve mechanism that stops digested food in the stomach from flowing back up the esophagus may not function properly. If this happens, acid juices are able to go up into the esophagus. They can sometimes reach the mouth. This is known as GER, or gastroesophageal reflux. Repeated GER can cause the acid to irritate, destroy, and scar the lining of the esophagus. From the mouth area, the acid juices can flow into the lungs. The effects of the acid juices on the esophagus, mouth, and lungs are what cause the symptoms of GERD. If not treated, complications of GERD may include inflammation of the esophagus, stomach ulcers, the increased risk of esophageal cancer in adults. Scarring that may narrow the esophagus can also happen. This is known as esophageal strictures. Esophageal strictures make it hard to swallow. The main cause of GERD is weakness of the sphincter muscle in the lower esophagus. Some substances can cause this weakness. These include caffeine, nicotine, alcohol, chocolate. In children, weakness of the lower esophageal sphincter is common. Once children learn to sit up and their muscles grow stronger, GER often goes away. For many children with GERD, the muscle of the sphincter in the lower esophagus does not get strong fast enough. Symptoms of GERD in children may include bitter or acidic taste in the mouth, sore throat or painful swallowing, hoarse voice, recurring pneumonia or ear infections. frequent vomiting or spitting up, wheezing, weight loss, refusing food or eating frequently. The first treatment option for GERD usually includes some lifestyle changes. Medication may be recommended if your child still has GERD symptoms after trying lifestyle changes. If other treatments are unsuccessful, surgery may be recommended.
Thank you for using Explain.